Hey, I need a doctor. Hello, everybody, and welcome. How is your mental health today? Okay, let's get real. It might be hard to ask for help when we're struggling, but to be honest, if we have the option, then we're the lucky ones. Access to help is a privilege that is not universal. Recognizing this is easy, but moving past the barriers requires innovation, coordination, and education. COVID-19 only increased the need for support, while making help even harder to find. We asked 4 experts what can be done to make access more equal, especially to those who are dealing with natural disasters and major crises.
The positive thing about COVID is more people actually turn to digital means to reach out to various communities. And even in Singapore Red Cross, we find that with digital means such as Zoom, we're able to extend our reach to different communities who are in isolation, communities who have to be quarantined because of COVID. With using digital platforms, it enables us to support more people during this difficult season.
Also, I won't forget to acknowledge that even this, when this is provided and put on the table, you'll find also there are people who will have the personal barriers when it comes to mental health. You find that people sometimes are not able to access mental health care because of issues with availability of the services, issues to do with transportation to that area.
Most experts agree that the best solution is to strengthen local, community-based support systems. In cases of extreme emergency or overwhelming needs, some organizations have developed apps, even using AI to help people cope with crisis. Our experts use a mix of available tech with a personal touch, including some old-school solutions.
We did 2 things actually. One thing was the free phone line that is accessible well to everyone, because more or less everyone has at least the telephone line, landline, even older people, so they can call and ask for help if they need it. And the other thing was that we had mobile teams helping people, reaching them in their homes, because they wanted to actually to speak to someone in person, even though it was like 2-meter distance between them.
So what we try to do is actually to have a combination of hybrid interactions, using digital means to actually share information and knowledge. I guess through that, it actually breaks down the boundaries that we previously encountered.
What we have to realize is that mental health support has many faces. What works for one does not work for all. And as Logic said,
pain don't hurt the same, I know.
And not all tools may save the day, but the real constraint is not being able to do anything about it.
It was like a mantra for us that information is saving lives. So we started a psychosocial support online chat. And then we started it realizing that through that, we will probably reach to much more than before, but we will not reach to some people of the population, for example, the elderly and people that do not have internet, or so on and so forth. The messages were more or less, it is okay to not be okay. And everyone can be affected. It doesn't matter what your status or age is. We can support you. We are there for you.
We can all relate to feeling blue. We can't be positive all the time. Remember, it's okay not to be okay. And do seek help from someone you trust or a trained mental health professional. What did you think about our talk today? Let us know in the comments below. And remember to like, subscribe, and share. It really helps us out.